Tai is now joining us live from Mombasa. Kevin, what's the latest from that side?
Well, and today is the session involving the governors from across all the by the government to deliver affordable and quality medical particular program, and have are raising very important questions to the government on how this particular program must be implemented, and some of them are saying that they will be having their own conditions, and they demand to be listened before the implementation of this program. And joining me quickly is Machakos Governor Alfred Mutua to just highlight to us what are some of the critical issues that were raised, and as governors you feel that they need to be addressed before the implementation of this program.
For us as governors, we are discussing two things. First of all, in Machakos, universal health care has worked very well. In places like Nyeri, there have been challenges. The amount of money needed for Nyeri was less. So some of us governors feel like we need, first of all, to compute what is the actual cost of actually treating somebody in this country. Because we feel like we have been pushed towards an NHIF insurance model, which, if we are not careful, is going to create a class system in our country. So you'll have the rich going to private hospitals, getting full care because they can pay for it, and our poor at the lower levels remaining poor because they can only be covered up to a certain level, because they cannot afford to pay more money. So what we're interrogating is to say, we want a system whereby it doesn't matter who you are, it doesn't matter whether you're rich or poor, you're getting a class system. So that this mentality of saying that we really cannot afford to provide health care to all Kenyans. Who said we cannot afford? We can afford to buy guns, we can afford to buy missiles, we can afford to build railways. We can really afford, from my perspective, it's a political decision to provide 100% health care to each and every Kenyan. This is going through a process whereby some people will be left behind.
These discussions are coming at a time the country is really battling with the pandemic. Yes. So is this also a factor that is being considered when some of this, conversation is happening?
Yeah, I'm a bit disappointed because we had a sitting with President Uhuru Kenyatta. We totally agreed that we need to look at a system whereby all the facilities in our country will be brought up to speed. We didn't have to wait for COVID. We look at a place where we can get money given to counties to supplement, to improve our system. Now we're going to an NHIF model. So for me, I'm a bit disappointed that what our experience in Machakos is basically not being taken into consideration at all. They've already locked themselves into NHIF. They say it's only affordable way. So our experience is out kabisa. For me, I feel 50 to 100 billion per year voted in by Parliament for UHC would work. And then we can work out on the other modalities.
So there have been some differences when it comes to financing as well. Yes, what is the county, what amount of money is the county government, county governments are supposed to pump towards this particular program?
It's not even that. It's already county government are pumping money because we are paying the salaries. We are paying for the equipment. We are paying.
How about the doctors and hiring of?
We are paying for all those people. So those are some of the things that we are looking into how to get them. And now the issue of health workers. They cannot tell us that they'll recruit from here a doctor in Nairobi to work in Machakos. Because whoever recruits you is one in charge of you. I want to be in charge of my doctor in Machakos because I can move them around. I can fire them. You know what I mean? If they're not working. But if they're hired by somebody else, then it becomes complicated.
Okay. Thank you so much, Mr. Governor.
Thank you. And what I'd say, this is a political will. And that is one of the reasons I'm running for president. Because I have seen better models all over the world without going to an insurance company that is right now serving just the rich. So they have to convince us that they'll be serving public hospitals. Because right now, majority of money of NHIF is going to private facilities just for the rich. We are creating a class system in our country.
Thank you so much. That is the opinion from Machakos Governor Alfred Mutua. And of course, remember that all the governors who are part and parcel of this conversation will be given an opportunity to address the government officials being led by Cabinet Secretary for Health, Mutahi Kagwe. I've also seen Devolution Cabinet Secretary Eugene Wamalwa, and of course also the Council of Governors led by the Chairman Wycliffe Oparanya. They are all here to angle out on all these issues and try to find a common ground, and also remember that the discussion surrounding COVID-19 is really a hot debate right now. Remember yesterday the CS Kagwe said that the country had lost only up to 54 people in only 1 week. So it is actually a debate that is bringing all together the issues affecting the health sector, and definitely we'll be